Can chiropractic care fix scoliosis? Hey, Dr. Chris Gubbels, and today I want to talk to you about chiropractic care and its potential role in treating scoliosis. So the first thing is you have to understand what scoliosis is and what it is not. Scoliosis is actually a 3D spine deformity, and we diagnose scoliosis by measuring it on an x-ray where we see at least 10 degrees of lateral bending along with rotation. Both of those have to be present for there to be scoliosis. It's important to understand this because a lot of patients are first presenting to chiropractors with scoliosis. And a lot of times it's when a parent has scoliosis or their child has scoliosis and they bring the child or themselves to go see a chiropractor because they realize there's something wrong with the spine, and chiropractors are known as experts in actually treating and fixing spine and musculoskeletal conditions. Most people think about chiropractic care with the traditional chiropractic adjustment or spinal manipulation. And what chiropractic adjustments do is they actually get joints to move properly. A lot of times joints get locked up or fixated where they're not moving like they're supposed to, or they can be out of position. And the traditional adjustment actually restores normal motion to joints, and in some cases actually can put a joint back into its normal position. Now, there is no evidence to support that traditional chiropractic adjustments can actually do anything to impact the potential progression of a scoliotic curve or reduce the size of scoliotic curves. Chiropractic can have an important role in scoliosis treatment. And one of the biggest roles is chiropractic adjustments help keep the spine moving properly. They can reduce pain and irritation, inflammation, and they can help just overall health and improved functionality. For an adult that has a lot of pain with scoliosis, their number one goal is to get out of pain or reduce pain. So chiropractic adjustments can help reduce pain by restoring normal motion of the spine. If you have an adolescent or a child that has scoliosis, we want to keep that spine moving, because when someone starts to develop scoliosis and they have rotation in the spine, you lose what's called normal spinal coupling motion, meaning the vertebrae cannot move like they're supposed to because they're in an altered position. And when that happens, the spine starts to get stiff, and as the spine gets stiffer, it gets harder and harder to fix or reduce the size of curves with things like exercises and bracing. So a chiropractor can do a lot to keep the spine moving properly and functioning properly, and also reduce pain. The other thing is, a lot of times people go see chiropractors when they have problems because they don't want to see the orthopedic surgeon, or they don't want to go to pain management. So they're looking for natural treatments. So a lot of times when patients are presented to a chiropractor, those are the perfect patients that will also be open to non-surgical or conservative methods like scoliosis-specific exercises and bracing. When you go to chiropractic school, there is a portion of school where they actually review and discuss scoliosis, how to evaluate it, different types of scoliosis, but they don't get into a lot of different treatments. It's just kind of a general overview. It's probably similar to other professions, but chiropractors probably go a little bit more in depth. However, I have talked to many chiropractors who have thought that they actually improved or reduced scoliosis with chiropractic adjustments. But most of the time, when we look at this in more detail, what happens is a patient may present to a chiropractor that has a lot of back pain. And because of their back pain, they may be actually holding themselves in an antalgic position or posture. And it looks like they have scoliosis, but it's really just a positioning due to pain. So what happens is maybe someone has a lot of pain and they're in an antalgic position, or they have a postural issue that someone thinks is scoliosis and it's not truly scoliosis, and they go to a chiropractor or general physical therapy, and they get worked on, and then they actually improve their posture, because chiropractic adjustment can have a positive impact or influence on posture, or they fix their pain and reduce their pain, and they're no longer holding themselves in an antalgic position, and then the patient, the provider think, oh, this treatment fixed scoliosis. And reality is it reduced their pain, it decreased the antalgic position, or it improved overall posture. Different than actually fixing scoliosis. Now, there are some chiropractors that specialize in scoliosis or claim to specialize in scoliosis. And the ones that are probably going to have the most merit to their claims are someone that's also advanced certified in chiropractic biophysics or possibly certified in doing clear work. Now, when you look at these providers, you want to take a step further and see if they are also trained to do bracing. Most chiropractors that are really advanced in scoliosis are going to be trained or certified in doing bracing, like a custom brace like Scoli-Brace. To take that one step further, look for a chiropractor that's also a member of SOSORT. SOSORT stands for the International Society of Scoliosis Orthopedic and Rehabilitation Treatment. Basically, it's the international organization that sets the appropriate guidelines for treatment for non-surgical treatment of scoliosis. And providers that are a member of this organization are going to be up to date on the best techniques, the best research, and they're going to know which treatments are appropriate for which types of scoliosis. Also, see if the chiropractor is trained or certified in scoliosis-specific exercises. The ones to look for are SROF, SEAS, S-E-A-S, which stands for Scientific Exercise Approach to Scoliosis, or Scoli-Balance. The Scoli-Balance is a newer technique, and it takes the best parts of scoliosis treatment from SROF, from SEAS, and chiropractic biophysics, and it combines those into a technique that's very easy for patients to do and also easy for the providers to do, and to be able to teach the patients how to do them properly. So in conclusion, chiropractic adjustments on their own have not been shown effective in impacting the potential progression of scoliosis or reducing the size of scoliosis, but they can be great for keeping the spine mobile and also reducing pain, helping overall spinal function. And the pain reduction and the increased mobility can be an important part of scoliosis treatment, but they should be done in conjunction with someone that specializes in non-surgical scoliosis treatment, and specifically someone that does scoliosis bracing and actually does scoliosis-specific exercises. The other thing is, as I mentioned earlier, a lot of times chiropractors are the providers that people go to because they have back pain or they have scoliosis, or a patient or a parent may bring their child to see a chiropractor with scoliosis, because a lot of people are not very educated on these conditions, which is exactly why we like to do these kind of educational videos. 50% of our scoliosis patients are actually referred by chiropractors. And that is because we have taken the time to go out and teach and educate chiropractors on scoliosis, how to identify it, and what the most appropriate treatments are. And whenever we get a patient that comes from a chiropractor, we co-treat and they still do chiropractic work. We just do the scoliosis-specific exercising or bracing.
So if you're finding this information useful, like, follow, or subscribe, and share with others you think would benefit from this information. And if you have scoliosis or you have a child that has scoliosis, don't hesitate to reach out. Just give our office a call and ask for a free consultation to see if there's something we can do to help you.